one of the most important organs that you are supposed to remember in the exam, friends, happens to be the thyroid. If I'm talking about the most common reason for development of hyperthyroidism, that happens to be Graves' disease. Patients not only are going to be having the presence of an increased functioning of the thyroid, they also have the involvement of the skin as well as eyes. At a microscopic level, you are going to be having the presence of increased number of cells over here. So there is going to be presence of a follicular epithelial hyperplasia. And this is going to be quite commonly associated with the presence of papillary formation. You would also be having an important finding wherein you can make out the presence of those empty looking areas around inside on the inner side of the thyroid follicles associated with the term scalloping of the colloid. So scalloping of the colloid, presence of follicular epithelial hyperplasia and papillary formation, that is what is going to be associated with the patients who are going to be having Graves' disease. The second important fact that we need to remember over here is the condition associated with hypothyroidism, that is given the name of Hashimoto's hyperthyroidism. Hashimoto's thyroiditis is going to be seen as a common cause of hypothyroidism, particularly in those areas where there is going to be sufficient amount of iodine that is going to be present, right? Now, this condition is going to be associated with increase in the size of the thyroid because the thyroid wishes to synthesize more T3 and T4. But because of the autoimmune problem over here, HLA, DR3, DR5 is associated. Female patients who are going to be having, the middle-aged female patients having the presence of an enlargement of the thyroid, they would be having the presence of lymphocytic infiltration. The lymphocytic infiltration actually is going to be responsible for the formation of a lymphoid follicle over here. And what is interesting is the patients can be having presence of cells which are going to be having the presence of an eosinophilic cytoplasm as well, eosinophilic granular cytoplasm. That's going to be given the name of Hürthle cells. So both hyperthyroidism and hypothyroidism associated enlargement of the thyroid, Graves and Hashimoto's, are going to be associated with painless thyroid enlargement. So read the question carefully with respect to what is the clinical picture that is being presented to you in the patient. We then are asked about conditions in the exam quite frequently, which is given the name of Quervain thyroiditis. So as we say, Quervain causes a lot of pain. It's a history of viral infection in the patients that causes an example of a painful thyroid in the patient, exquisitely painful thyroid. And because it is going to be following a viral infection, so as a viral infection is going to subside, the pain is also going to get better. So it's a self-limiting condition. Maybe patients may be requiring some bit of analgesics in the initial phase, but classical history of a female having a sore throat or a viral infection, then she's having the presence of a painful thyroid, and microscopically it is going to be having the presence of giant cells which are going to be seen and the presence of the colloid filled follicles, right? So that's what we need to remember over here. We are sometimes asked a question in the exam pertaining to a patient having a thyroid which is very firm and woody thyroid. This is associated with the presence of IgG4 related disorders, and this is an example of a thyroid which is going to be given the name of Riedel's thyroiditis. Just remember the fact, Riedel's thyroiditis is something that you would see in a younger patient. The woody thyroid can be seen also in a patient suffering from a thyroid cancer, but that kind of a thyroid cancer would classically be seen in case of an elderly patient. So cancer is usually seen in case of an elderly individual when we are talking about a woody thyroid, and young patient having a woody thyroid is going to be Riedel's thyroiditis.